Folkestone, Hythe and rural PCN consists of a patient population of around 49,000, and we're located on the South Kent coast. We have 7 member practices, ranging from our smallest being around 2,500 all the way up to 12,000 being our largest practice. So this project started for a number of reasons. I think one of the main things in our area, we've had problems with recruiting GPs, and as a result some of our practices have almost 2,500 to 3,000 patients per whole-time equivalent GP, and as a result we were looking to bring some efficiencies with the staff that we had within our PCN to deliver services as well as support with some of the extended access. The second thing came around 2020 with the pandemic. We saw rising demand and also a shift to more remote consultations. So the online consultations that were coming through to each practices became quite a lot for some of our practices, and they really struggled to cope with that demand. So we were looking at a way with that how we could sort of centralise the processing of that and provide additional capacity and resilience for our practices through using PCN staff and resources.
So what we've built is essentially a PCN level clinical system. So we've worked with suppliers to develop and enhance functionality to allow online consultation journey for a patient to be the same, that they're still doing that on the practice website or via the NHS app. But we see those online consultations go into our PCN level clinical system, and we've got an advanced clinical practitioner-led team that now triage those online consultations rapidly, respond to the patients directly through messaging or through phoning the patient, and either see those patients face-to-face or loop them back in with the practice if it's complex or requires continuity of care. So on the staff side, the feedback has been really positive. They were trying to work across 7 different practices and all of the associated systems. So they would have somewhere between 35 and 40 different logins to try and manage across those 7 practices. But now they're logging in once and they're consulting in one system, and we've had really positive feedback. We're delivering about 2,500 additional appointments back to patients a month. We deliver around about 950 minor illness appointments as well, and that's additional capacity that wouldn't have been there.
Prior to the PCN hub being developed, patient experience was variable across the surgeries in our PCN, and one of the driving factors here was we wanted to reduce inequalities across our patients, and we really feel that we've achieved that now through this PCN hub operating model. Practices also are reporting the benefits now from seeing this, because they're seeing a reduction in the demand that's coming through at a practice level, as well as the PCN is able to absorb some of the demand that's coming in.